Lillian Njeri waits, hopes to have her persistent cough attended to at the Kiambu Level 4 hospital.
Kuja hapa mwendo wa saa 5 na nimetibiwa lakini sijapata dawa. Kifua, kichwa na kisungusungu na kutapika sana.
She's had it for 3 months, but it's gotten worse the past month. At the hospital, there is just a handful others waiting in line to be attended to by the equally small number of medical staff, the few employed by the county government, and who've ensured that patients at least get basic services.
Masikini wenye hawana pesa watakufa tu na magonjwa kwa nyumba. Wenye hawana pesa za kwenda private. Sasa kama mimi ninataka nikae nikionaona daktari, sasa nimekaa kwa nyumba na ugonjwa juu hospitali ya pesa siwezani nayo. Ningeomba tu madaktari tu warudi tu juu ya watu wenye hawana nguvu kama mimi.
Lillian epitomizes the trouble in the health sector that is now in shreds. Her story and that of many others, an old chapter in the first pages of the new year, a story whose conclusion seems a long way off as efforts to end the chess match between the government and the health workers appear stuck in the waiting room. The president dashed any hopes of finding a cure to the crisis in the health sector. In his New Year's speech, he said the government just doesn't have any money to pay the workers and end the strike that is still a source of pain for many.
I have seen the suffering of patients as doctors go on strike, and we have worked hard to arrive at a workable solution with the doctors, but there are limits to what the government can manage and still be a responsible manager of the people's finances.
The courts have declared this strike illegal. 45 counties have advertised jobs for 405 doctors, dentists and pharmacists in an attempt to replace those taking part in the strike. The government also accuses the doctors of ignoring the counter-offer it made. But doctors have, behind the picket lines, drawn the line.
We have been offered 2 packages which we did not bother to respond to. We don't know which mechanism we should have used to respond to those offers, and those offers have not reached us on the negotiation table. Indeed, we have actually attended over 6 meetings. In all those 6 meetings, our position has been very clear, that we want the government to present an implementation plan that we can discuss.
The CBA, apart from improving the terms of service for the doctors, also addresses the absorption of intern doctors and the employment of more to plug the shortage. It also provides that all doctors in all facilities be properly equipped with the tools necessary to do their jobs.
While we have made strong investments in health and maternal and infant mortality, too many Kenyans are still dying from preventable and treatable diseases.
But this investment appears to have fallen short of expectation. Public facilities have been buckling under the weight of this surge in the number of patients seeking help and with limited means of attending to them. This an indication that the sector may still need another injection, as a huge number of people still cannot afford the high out-of-pocket expenditures on health. With the doctors playing hardball and the government not playing ball at all, it appears it will be a long-drawn stalemate.
Come New Year, we are urging our members who are in manufacturing, distribution, wholesaling, and even at the retail level, not to distribute any products to facilities where there are no qualified people there. We cannot give poisons to go and be mishandled by people who are not competent.
And that prescription will be a hard swallow for the biggest casualties of the crisis. Patients like Lillian caught in the loose ends of the stalled negotiations between the government and the health workers. Sheila Sendeyo, NTV.